on time. We'll start off right away. Purposeful Aging 6th session. Today, the 27th of June, 2026. My name is Christina Kadama, your moderator this morning. Topic, managing multiple medications in older adults. Our usual caregivers, older adults, you are all most welcome to this session. A special welcome to those of you who have been with us all along, every last Saturday of the month. To give a little background to this session, health management has evolved significantly. In the days of my grandmother, a visit to the clinic, and that was after a long distance walk, patients were expectant of getting an injection, what they call a mpiso or a chikato in some languages. This chikato will be the ultimate cure for almost every ailment they presented. Today, when people come to various clinics, they walk out with packets of various types of medication to go back home and sort themselves out. Now, to guide us through this complex subject of multiple medications, Purposeful Aging family is incredibly blessed to have one of our very own with us today, and that is Dr. Gyaviira Makanga. He will share with us his expertise and practical insights on how to navigate multiple medications safely and effectively. Profile for Dr. Gyaviira Makanga. We've been with him several times, but I'll go over again. Dr. Gyaviira Makanga is a Ugandan-trained physician with specialist training in nephrology, that is kidney diseases, and hypertension, that is high blood pressure. While receiving his specialist training, he had the opportunity to manage patients with kidney diseases and hypertension in Tanzania, in India, and in Norway. In Uganda, he has worked in the Mulago Kidney Unit and was involved in teaching of students at the Makerere University College of Health Sciences, MUCHS. Currently, he works at the Bank of Uganda Specialist Clinic, where he's actively involved in managing retired senior citizens and the bank staff. Dr. Gyaviira also does pro bono services as an honorary lecturer in the Department of Medicine at Makerere College of Health Sciences. And Dr. Gyaviira is also part of the interim organ and tissue transplant working group that is in Mulago Hospital. Dr. Gyaviira, you're most welcome. Before you, we have older adults and their caregivers. And these are ordinary Ugandans and not necessarily with medical background. So we speak the language of an ordinary person to them. You have 40 minutes to take us through this subject, after which we shall call for interactions, questions, and comments from people online, and then we'll close after about an hour and a half. Dr. Gyaviira, good morning, and you can take us on.
Thank you so much, moderator, Dr. Christina. And good morning to you all, listeners, the elders on the forum, the caretakers, and well-wishers. I'm glad to be back again to share a few insights in medical issues. And this time around, like the moderator has introduced, it's a complex topic, managing multiple medications in the elderly. Allow me to share my slides. I don't know if they are visible.
Yes, we can see it.
Okay, let me just put it in presentation mode. Sorry, this is okay. So like I've been introduced, my name is Gyaviira Makanga, medical doctor, and we'll go through this complex topic, like they've said, managing multiple medications in older adults. Now, this is quite complex, but I'll try my level best to make it as non-technical as possible. And this topic becomes a lot more complex, especially when you're dealing with the elderly, like we shall see. And this is what I'll discuss in these next 30, 40 minutes. What do we mean when we say multiple medications? In the medical term, it's also called polypharmacy, but I'll stick to multiple medications. We'll just look at a few of the common myths about this subject of multiple medications in the older subject. Now, we're going to be confined mainly to the older subject. It can affect all age groups, but for the sake of this discussion, it will be the older subjects. And then we'll look at the burden and impact of using multiple medications in the elderly. And then we just wrap up the whole management of how do we manage this complex topic. So those will be my talking points. And we shall probably have a Q&A at the end. So the definitions. So again, for the sake of this presentation, we'll define our older adult as someone 60 or greater, 60 years or greater, because there are some areas where they consider a 50-year-old and above as an elder. Others it is 65, others is 75. But let's stick to 60 years old.
Right.
And multiple medications is basically taking 5 or more medications regularly for whatever period of time. Now, there are those who actually take more than 5, and we'll call those who take, for example, 10 and above, those will be categorized as excessive multiple medications. And we'll see the reasons why that can. Now, it's not about numbers per se when we talk about multiple medications. Sometimes it comes down to whether the medications you're taking are actually the right medications and for the right reasons, and if they're actually going to bring you a health benefit. And these are some of the common myths that I've personally come across when I'm seeing a bit of some of the elderly patients. And many of them will tell you that they feel safer taking many medications because, which is not entirely true, like we shall see. And some have actually told me personally as a doctor that they must be taking supplements when they are old, which is true and false at the same time. And we shall see the reasons why. Taking multiple drugs is a natural part of aging. This is another myth that is not entirely true. And then others, the moment they hit those advanced ages, they take on the natural supplements that you shall see. I'm sure about more than half of the people here above 50 years old are probably on some kind of supplement. And then the other myths are usually to do with the differences we have in our, for example, spiritual beliefs, ethnic differences, and the level of trust in a health system. Now, especially the senior people, when they don't have a trust level to a health system, most of them will go out and use other modalities, and that usually leads them into multiple medications of all sorts, including herbal remedies, all the spiritual herbs and all that. And we'll see some of the challenges that they face when they get to interact with these drugs. Now, how common is this problem? More than 60% of elders above 60 years old are taking 5 or more medications. So if we have 10 senior adults here above 60 years old, about 6 or 7 are going to be taking 5 medications or more. And these multiple medications, this is now worldwide because we don't have a good statistics about multiple medications in the elders in Uganda here. I'll just use the general statistics that I came across. More than 30% of hospital admissions among elders is probably due to the effects of multiple drugs that the senior adult is taking. Now, as if that's not enough, up to about 30% of deaths among the elderly are actually contributed to the interaction and side effects of multiple medication. It goes even higher with the increasing number of use of these drugs. So we are very concerned about the drugs that adults take, and very many falls that adults sustain, especially the seniors, are attributed to the interaction of multiple medications that they are taking. And this is quite significant worldwide. Now, the other important aspects about this problem is that women tend to be more of the consumers of multiple drugs than men. And there are many reasons why. And one of them is their biology and genetics. Women naturally tend to live longer than men. This is worldwide. And because they live longer, they are definitely going to encounter a lot more comorbid conditions. And each comorbid condition will come with its own issues with medication. Now, women also, because of the nature of their biology, they tend to clear out drugs from their system much, much slower than the men counterparts. It's because of their biology. And secondly, women are more likely to actually ask for supplements. Actually, just this week alone, I know I received about 2 or 3 women above 60 asking me to refill a good number of their supplements. And then usually we get into that discussion, why, and we shall see some of the reasons why. But the other sad thing that I've actually put in bold is that on a social aspect, women are more likely to be the caregivers in most instances. And sadly, because they're the caretakers, they actually don't have a caretaker themselves when care is needed. So there is this challenge. You have an elderly lady looking after maybe a spouse or another elderly person, but they themselves are actually not being cared for. So they end up having challenges with their medication. And this is a very big challenge worldwide. but more so in our setting here. So what are some of the things that influence taking multiple medication in the elderly? One of them, of course, like I said, is the multiple conditions that come with age. So someone will have diabetes as the risk of all these conditions, high blood pressure that we've discussed on this forum, diabetes, joint diseases, dementia, and all of them come with multiple medications. And because of the so many conditions, many of them start to fragment their care. Fragmenting here meaning they go to very many different doctors or specialists. And the way it's done here in Uganda is that people do not do proper recording of medication. So each doctor wants to prove that probably they are better than the other or know a lot more than the other, something like that. We've seen all these problems. So they keep adding on medications. And if there's no proper communication, then we get all these challenges that we're going to see. Now, in addition to all this, the patient usually will also self-prescribe. And this adds on to all the problems. In addition to that, supplements. And we'll discuss this very briefly in the coming slides, because many people think that supplements are actually not drugs. Many of the supplements actually have what we call a therapeutic effect on the body, like we shall see. And in addition to supplements, so someone is taking all these drugs from different doctors, they have self-prescribed, they've added on a supplement. They are also taking herbals. Now, when we talk of herbals, some people leave out things like herbal teas. There are many herbal teas on the market, and very many of them are actually have a therapeutic effect in them. And we'll see probably a few of them later on. Now, there are others that I will put in quotes, drugs, things like alcohol that many clinicians or doctors may not inquire about, or caffeine that will have an influence on the many drugs that all supplements or herbals that the patient is taking. The other is the influence from family, friends, colleagues. I'm sure you've heard this term that this healed me, please try it. Many times people do it in good faith because it healed them, so they want to share it with another person. But little do they know that we're all different. We've been created differently. Our genetics is completely different. What works for me may not work for you. And it becomes worse in the elderly, like we shall see, because everything changes. So this influence, and it is so strong, especially in our environment here, where people, especially when there's lack of trust in the system, someone will want to prescribe for another person without considering their inbuilt genetics and problems. And then we have our friends, the religious part of it, the pastors, the priests, the traditionalists, who will also dispense their own. Now, this last three boxes, the influence from family, the prescriptions from the pastors or religious people or the herbalists, many times these are hidden drugs that are not reported to the clinician. And then we have the other monster, which is the social media. There are lots and lots and lots of messages coming through. Some are genuine, but very many of them are not backed up by any science. So, and because most of our elders now have smartphones and have access to all this information, they get all this that, oh, take this concoction, it will heal this, it will probably cure this and that. I know there are so many, like, for example, there are so many things on the media about stem cells. Maybe we'll have a discussion on that, that it will cure this and that. And it's all on social media. So some people have actually abandoned drugs to take on those, or some have taken them on and are using them concurrently with other drugs, and it's causing a bit of trouble. So these are some of the challenges or factors influencing multiple medications. And what are the effects of this whole problem? One of them, of course, is the adverse effects. And many times when you're taking medications, so many of them, you're going to get side effects to these drugs. And these side effects, many, many, many times, are going to be mistaken as a new illness. And that new illness, for a doctor or a health worker, they will actually add you or add the patient more drugs, creating another whole cascade of events. Now, multiple medication have also been associated with falls, like I said, hospitalization. And once the patients are hospitalized, they tend to stay longer because of these drugs. Now, this is all in context of the elderly patient. Functional and cognitive decline. Of course, there's stress for some of and mental distress because the drugs are so many. There's a financial constraint on the family, on the patient. And if death is a complication or an effect, there's death related to drugs, like I said earlier. Now, what are our concerns? When we review a senior patient, someone about 60 plus, there are things we need to put into consideration. One, of course, is those comorbid conditions that the patient has. We need to factor in all the medications. If I'm seeing someone for the first time, all the medications that they are taking and the potential interactions that they have, we're going to see all this shortly. The side effect profiles, the pill burden, and then stigma. This is very, very important because very many seniors do not want to reveal certain medications they're taking to their doctors. For example, some are still taking illicit drugs, others will be taking HIV drugs, others are taking slimming drugs, which are very popular right now. And these drugs are still have that stigma attached to them. So many times we need to dig deep. And maybe it's incumbent upon the doctor or the prescriber to get the trust of the elder so that the elder can reveal all the other drugs they're taking. Storage of their medicines. Now, this is very important, and I'll give maybe a specific example here. One of the common supplements that is on the market right now that very many seniors are taking is omega-3. I'm sure a good number of us here are taking them, omega-3. Now, omega-3 is one of the examples I'll give in terms of storage, is a very extremely sensitive supplement. It's sensitive to light, it is sensitive to air, the oxygen. So, and it easily gets damaged when exposed to light and to air. So, and that's why, if you look at those of you who have omega-3, that's why the container is, usually the drugs are packed in a very dark container. And the reason for that is to prevent that light denaturing the drug. So, and there are some seniors here, I'm sure, who have what they call a drug or pill organizer, where they put pills for the rest of the week so that at least it reminds them and organizes their drugs. I'll show just like the one that is on your right. Omega-3 should not get into that pill box because it's going to be denatured by the time you take it. And once it's denatured, it no longer serves the purpose. And once it's denatured also, it's going to interact with the other drugs that you're taking. So storage becomes a very important aspect about medication. So omega-3, those of you who are taking it, please store it in a very dark, cool place. Then we also look at the compliance issues, the source of information. I already mentioned that a number of people, including young people, might be getting source of information about their treatment or their drugs from probably inappropriate sources, which can affect their treatment. And we also want to look at the support system of the elder and then the cost of the medication. These are all among the very many aspects that we usually want to consider. Now, multiple medications. Why are we very concerned as doctors about multiple medications? Now, multiple medications always equal to drug interactions. The way we mix food in our kitchens, and sometimes during that mixing, food goes bad at the time of eating it, is the same principle here. When we mix drugs, something good may come out, or something disastrous might come out. Now, drugs might interfere with fellow drugs. We call that a drug-drug interaction. Drugs might interfere or interact with food that we eat, and we'll have a look at some of them. They might interfere with your supplements. They might interfere with the herbs that you probably did not mention. They might interfere with alcohol. All drugs might also interfere with your own disease condition that you're having. For example, my area of specialty is kidney, and once the kidneys start to misfunction, the drug side effects and adverse effects and interactions become very profound, and we'll probably discuss that shortly as well. So why are seniors more prone to complications or multiple drugs? And maybe before I go that, I just want us to picture this, what the drugs go through when we take them. And I'll just specifically maybe use the ones that all of us know, that probably tablets. Because when we take a tablet, some of them are going to be absorbed in the mouth, others will be absorbed in the gut, in the stomach and intestines. And once they're absorbed, they get into the bloodstream and are distributed to that area where they are supposed to work. And we call that the distribution part of the drug. And once they've done that job, they are supposed to be modified into a certain either non-toxic drug that can be easily removed. Now, there are two major organs that modify, actually three, that modify the drugs, which we call metabolism, because they have to be broken down and transformed into something that can be easily removed. That's our liver and our kidney and sometimes the intestine. And then the kidney and the gut are usually responsible for removing the waste product of the drug. Now, as we grow older, all these aspects, from the absorption to the distribution part, to the metabolism, the transformation part, and excretion, are interfered. And it's a natural process. So seniors are prone to these complications because all these four aspects of the drug are impaired. And we probably won't go into detail because it's a huge topic around there, but just for you to keep this at the back of your mind as we go ahead. And so what affects that drug cycle? The absorption, the distribution, the transformation, and the excretion. One, of course, is the age. As we age, of course, the kidney, for example, and the liver can no longer perform their function as effectively as they were when they were probably a 20-year-old. The disease condition, for example, heart, liver, and kidney, these are among the many organs, sorry, the major organs that are affected when we age, because they also age. So the liver, for example, which is supposed to denature drugs, is not going to denature drugs effectively. The kidney will not be able to excrete the drugs as efficiently as possible. The heart, for example, might not be able to pump as much blood to distribute the drug effectively. So all those have an implication on the drugs that you're going to take. And then the genetics is definitely, this is also very complicated. And like I said, one of the factors that influence multiple drugs is someone sharing drugs or advising when they are not without any medical background. Of course, we can't blame them because they may not know that all of us have underlying differences in our genetics and how our bodies process drugs and how the drugs affect the organs. Now, the other is, of course, how the drugs interact with each other, and we shall see some of them, and how the environment also affects. Now, in the last talk on this forum, we had someone, I think, come and discuss how the environmental toxins and chemicals affect our bodies. Now, those same chemicals that gentleman ably discussed, the toxins we ingest, the pesticides we ingest, the smoking, also have an influence on how these organs work, and they also interact with the drugs that we take. And some of those chemicals are actually kind of drugs. They have a therapeutic effect or a drug effect. So when we are factoring in all this, many times we also look into that. And this will affect the drug cycle, like I said. So when you talk about drug interactions, what do we mean? And what we mean here is that when you take a medication, its effect is going to be altered by another substance. And that substance could be another drug that you're taking. It could be a food. It could be a beverage. It could be a supplement. It could be a herb, or it could be the underlying condition. And the effect of which between that interaction of your drug that you're taking, for example, if it's a high blood pressure medication, it's going to, if it interacts with another drug, its effect might be more pronounced, meaning you're going to get a very big drop in your blood pressure, or the other drug or the other substance might denature it, so that drug that was supposed to probably reduce your pressure is not active because of the other drug. Or that combination might actually cause some unexpected side effects. So many times when we mix this drug, we may not even know what kind of interaction is going to happen. But there are some that have been well studied and we know, and we'll look at some of them. So very briefly, I'll just talk about some of the common drug interactions. The very common one. Let me start with, these are now drug interactions, and then we shall look at drug-food interactions. There is a drug that we call ketoconazole. These are a bit complex names, but I'll break it down. Ketoconazole is a drug that we use to treat fungal infections. When we mix that drug with, for example, a drug called atorvastatin, I'm sure there are quite a number of elders here taking it. These are drugs that we use to reduce cholesterol levels, cholesterol that clogs the blood vessels. These are drugs that are usually used by the heart specialists to prevent, heart attacks and strokes and all that. Now, what this drug does, ketoconazole, is that it works, it's broken down in the liver or processed in the liver, but it does something very interesting. It prevents the breakdown of the statin. So if a statin, for example, was to work for about 18 hours, meaning you will take it once a day, this ketoconazole drug is going to prevent its breakdown. And so one dose of atorvastatin, which you, for example, took today, is going to linger on in the body for a much longer time into the following day. And the following day, when you take another dose before the previous dose is eliminated, you're going to get an accumulation of that statin drug. And an accumulation of a statin drug is going to cause us a lot of problems, especially to the problem. So it's going to cause a lot of muscle pains and aches. And once that goes on for a long time, the muscles start to break down and release a pigment that will cause kidney failure. At the same time, when that same drug accumulates in the system, it's going to damage the liver because the liver is now overwhelmed at processing it. So these are some of the things we have to look at. Now, on the other hand, the second combination here called rifampicin and amlodipine. Rifampicin is a TB drug, but I'm giving this as an example, ketoconazole, because there are many other drugs that will do the same thing like ketoconazole does. Rifampicin is a TB drug. Now, for it, it does the reverse to many drugs. What it does, it's going to deplete other drugs in the system. So, for example, I'm sure there are many of us here taking a drug called amlodipine. Amlodipine is a drug we use for pressure, one of the commonest drugs we use for lowering blood pressure. So when you combine it with rifampicin, rifampicin tends to wipe it out of the system within a few hours. And what that means is that your blood pressure is not going to be reduced and the pressure will go up. And what that means in the clinical setting is that a clinician or a doctor will keep adding more and more drugs. And lo and behold, when the rifampicin is removed, those so many drugs are going to drop the pressure down. And that will be disaster. Another example would be that rifampicin. For example, if someone has got a clot, there's a drug we use to treat clots called warfarin. And once the rifampicin depletes the warfarin, then that clot is not going to be resolved. So you'll continue having your clots. So these are some of the drug-drug interactions that we can get. Now, there are others, like, for example, there's a drug that we use to treat acidity in the stomach or ulcers called omeprazole, and that family of drugs, it's quite common and very cheap on the market. When we are, for example, when we combine it with iron, we use iron for example, replacing or boosting your blood levels. We are supposed to take iron on an empty stomach when there is a bit of acidity because that's how it's absorbed and it's distributed blood system. But when we combine it with omeprazole, omeprazole tends to reduce the acid in the stomach. So when you combine the two, if you take them all together, then the iron is going to be totally useless. There will not be any absorption of the iron. Now, the other drugs we look out for example, especially in the seniors, many of them, I think we've had a discussion on this forum on sleep. There are those who take this drug called diazepam for sleep. And if we combine that drug with another painkiller called tramadol, which many people like to take for pain, because it is safe, for example, for people who have ulcers, because the other drugs are like, for example, diclofenac, which will cause ulcers, are usually avoided in the seniors. These two drugs will have an additive effect and will cause excessive drowsiness. And because I said as we grow older, the clearance of drugs in the system is delayed. These drugs will keep accumulating and someone will come down with a lot of drowsiness, dizziness, falls. And the other side effect that these two drugs do, they are called opioids, especially the one called tramadol. They tend to suppress your breathing and they have led to death in very many elderly patients. So these are some of there are so many other drug-drug interactions, but I just picked out a few of these. Now let me just move on to drug and food. So we just switch over into our kitchens. I'm sure a few of you have used some of these this morning when you were having breakfast. Now there are some of these things in our kitchen that we have every day. Ginger, turmeric, garlic, which are very, 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 very beneficial health-wise. I'm not against them, but I just want to bring them in the aspect of multiple drugs. Now, on their own, ginger and turmeric, they tend to lower blood pressure. And they also have a blood thinning effect. But when used in large doses, extremely large doses, because there are some people who take a lot of ginger and a lot of turmeric in really large doses, and you combine them with your drugs, then with the effects of your blood, for example, if you're on blood pressure medication, your blood pressure is going to drop. And you will not know that it's actually the effect of your kitchen, your garlic or sorry, ginger or turmeric. So I just put an example here of you're taking your amlodipine, you're taking your warfarin that your heart doctor gave you, and maybe aspirin, because many adults are on aspirin to prevent, for example, clots, and you're taking high doses of ginger. You're going to get very low blood pressure. You're going to get dizziness. You're going to get falls like these two friends of mine. And because of the aspirin, there is a high risk of bleeding and you're going to bleed. So these are like two completely fatal accidents within you. And of course, you're going to fracture. So we need to be careful, especially for the elderly patients here who are taking multiple medications and are using ginger and turmeric. I'm not saying stop them, but you can still continue using them, the ginger and garlic, but in moderation, because they will have no problem when used in moderation. So let people not get me wrong that I'm stopping you from taking ginger or turmeric. No, just stop using the high doses if you're on multiple medications. Now, the other, of course, is garlic. Garlic does exactly the same as what ginger does. It has blood thinning properties. It has blood pressure lowering properties, among the many other benefits that it has. So anyone taking multiple drugs, especially for high blood pressure, blood thinning drugs like aspirin, please use garlic in moderation. In moderation. Then there's another interesting food. Many of you might have it in your kitchens, called the grapefruit. It looks like an orange. It's a very nice fruit, but it does exactly what I talked about with a drug called ketoconazole. I talked about a drug called ketoconazole. Ketoconazole kind of slows down the clearance of drugs. This is exactly what this fruit does, the grapefruit. It reduces the clearance of multiple drugs, very, very many. And then they accumulate and they will cause side effects. So if you know of this fruit and you're taking it, please avoid taking it with multiple medications. Or if you're going to purchase it, please always consult your health care provider for any possible interaction between that fruit and the current medications you're taking. So these are some of the hidden, I will call them drugs in quotes. They are healthy, they have benefits, but they have a therapeutic effect that we fear if combined with with other drugs, especially in the elderly. Now, what about supplements? Now, turmeric is a supplement, can be a supplement, like I said. It does those other effects that I talked about. I highlighted calcium here. Calcium is a very interesting supplement, which most of the elders need, because as we grow older, our bones start to weaken. We start getting into menopause, especially the females who get it earlier. But we need to use calcium with caution, especially if we are taking many other drugs. Calcium, iron, and magnesium, for those elderly patients who are taking, for example, thyroid hormone replacement, need to be careful because calcium tends to combine with those thyroid hormones, and the thyroid hormone will be ineffective. It will just move through your gut and it's passed through the toilet. Now, calcium also, for those who are taking anti-HIV medication. There's one particular one called dolutegravir, or the combination these days is called TLD. It's one pill a day. They've made a bit life easy for people taking antiretrovirals. So the component TLD, the D component in that combination, doesn't go down well with calcium because calcium combines with it and it's just washed down the drain in stool. The other challenge with calcium sometimes, especially with antibiotics, some particular antibiotics, I'm sure the elders here will know antibiotics like the tetracyclines, which probably used to use long ago. But I think one that is still very popular now is called doxycycline. And then there's another group of antibiotics called, maybe I said I will not be so technical, but other examples called ciprofloxacin. I'm sure many people here know it, or levofloxacin. That class of antibiotics tends to combine with calcium and it forms a kind of complex that will just be washed down into stool. So if you're treating an infection, for example, a urinary infection, a throat infection, using those drugs, you will not get a response. And then that will mean getting your doctor putting you on more and more drugs, which will probably even have other side effects. So we need to be very cautious with the calcium because it will interact with all those other medications. There's another one called vitamin E, which very many ladies take. Now, vitamin E on its own has blood thinning properties. So when used with other blood thinning drugs, there's an increased risk of bleeding, especially when we're using vitamin E in high quantities. So these are some of, again, the few common drug supplement interactions that we use. And another probably caution about these supplements, and again, I'm not against any supplement here, but we need to use them with caution and with the right guidance from your healthcare provider, because the supplement industry is one of the biggest industries worldwide that is unregulated. And when you look at, I think, a country like the USA, which probably is the biggest consumer of supplements, their Food and Drug Administration does not regulate that industry. So people have taken it upon themselves. Some of them actually manufacture the supplements in their own kitchens and pack them and send them out, with a very nice message. And many of our relatives who are abroad, pick these supplements and send them to us or to our elderly patients that, oh, this is good. It will probably heal your dementia or improve your dementia. So we need to be a bit careful, especially the content of the supplements, the dosage in there, and which other drugs our patients are taking so that we can guide properly. Now, the other one is the drugs, the herbs. Now, these many herbs that people are taking around here, they are also very active. They have very many therapeutic effects. And for very many of them, we do not have any idea what is contained in there and what interactions they will have with our conventional medicines. And it's a very big public health concern because when we get complications here, then we won't be able to tell, was it the conventional drug? Was it the herbal medications? But a special caution, especially to the elders, if you have a kidney problem or a liver problem or a heart problem, then it's probably safer to stay away from the herbal medications because we do not know how they will interact with the drugs your other kidney specialist or liver specialist or heart specialist gave you. And it's more important, again, to the elders, especially those who are taking high blood pressure medications, diabetic medications, blood thinners, cancer treatment, and HIV, for example, HIV medications, to stay away from herbal medications that we are not sure or certain about, because we don't know what interaction is going to happen there. So that's to do with the herbals. Now, what about our friend alcohol? Of course, there are very many elders, I'm sure even on this forum, who still engage. And one, I think the latest recommendation for alcohol is no alcohol at all. So back in the day, it was a little glass of wine is healthy for the heart. But now it turns out that actually even that little alcohol is not safe at all for anyone, especially so in the elderly, and more so in that one who's taking multiple drugs. You remember I did mention the drug cycle, that one of the things that affects the drug cycle is the genetics. Because we have totally different genetic buildup and how we metabolize and the body utilizes alcohol, you can't tell what direction the alcohol is going to take, especially when combined with drugs, because alcohol could either speed up the clearance of drugs or it will slow down the breakdown of various medication, including the herbals and supplements. For example, those who are taking sleeping pills with alcohol are going to get a prolonged effect of those sleeping pills, and they will get all these prolonged daytime sleepiness, drowsiness, lack of concentration, suppressed breathing, and that can lead to death. So our recommendation here, general bold recommendation, is please avoid alcohol when taking any medication, especially the elderly. Let's avoid that. Now, let's come to management of the drugs. Now, this is teamwork, and it involves the doctors, and many times we shall also bring in the expertise of the geriatricians. The geriatricians are the ones who manage the elders, the pharmacists, dispenser, but the two key people here is the caretaker and the patient, and then the family. And this is the team, and the management of this can be very, 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 very complicated, especially when the team is very uncoordinated. And we usually want the regular reviews of the elder and at each review, we always have to go through the drugs and look at them. And then there always has to be a clear communication between the doctor, the dispenser, the patient, the caretaker, and maybe the family when it comes to this. In some instances, we use what we call medication management tools. For the prescribers, like the doctors, sometimes there are tools that help us to look at, for example, drug interactions. There are very many online that they can download. And for the patients, we can use these pill organizers to help the patient, or digital reminders so that they don't forget their drugs or take their drugs on time. And always, for any prescriber that is here, we should always involve the caretaker for those senior patients whom we think might be compromised, especially in terms of their cognition. Now, what is the role of everyone? So the prescriber, who might be me, the doctor, there are many things we consider before we prescribe. One of them is the age of the patient, definitely, because as we grow older, very many things have to come in. That drug dosages have to change. We have to reduce the dosages because of the new aspects of the kidney and liver issues. We have to avoid certain drugs that do the same thing. And these, for example, if you have drugs that are going to cause drowsiness, then we have to be very careful, either to reduce the dosage of one or eliminate one. We have to consider the side effect profile of the drugs, the interactions that I've talked about, and then we always have to look at the underlying comorbidities. What is the liver functioning like? What is the kidney functioning like? How is the heart? And this is where the teamwork comes in. And then we have to also now look at all the existing drugs that this person is taking, including the hidden drugs that I talked about. The kitchen, we also have to probe into the kitchen. How are your eating habits? What do you eat? What do you consume most? The teas, the alcohol. And then we start to remove unnecessary medications. We call this de-prescribing. And this is very important at all reviews. When we look at the drugs as the doctors, we need to look at the unnecessary ones and take them off. And then we need to also factor in the non-drug treatment aspect. And we shall have a look at some of what we can do that is non-drug that will help the senior. So after doing that, it will be best if we give a patient a card that looks something like this, where there is the patient's name, the doctor's name, and contact, because in case they get a problem, they can easily access the doctor. The pharmacist's probably name and phone contact. In some hospital settings that are well established, they will have a general line that answers emergencies, because the doctor may probably be away. And when it comes to the medication, we have to clearly label the drug. We don't want to usually use a generic name. We want to use the original name, like, for example, paracetamol, and not, for example, Camadol, so that it's a known name to all the other clinicians who will see the patient, and the reason for use of the drug. So we can maybe say this is amlodipine, and then in brackets we can put the generic name. It could have another, for example, a company name. And we put the reason for use, maybe for high blood pressure. And then we can put in the section of the describing the drug, it could probably a tablet or a capsule or a syrup, and when to take the medication. And this has to be very clear. Probably take one in the morning or take one in the night. And special notes on the other side. Now, the special notes could be something like, do not mix this with milk. Do not maybe take this 2 hours away from a meal. The instructions need to be as clear as possible. And we encourage the patient to bring this card each time they come for a review, or when they are going to see any other specialist or any other doctor, to carry it so that everyone knows what particular medication is. And sometimes we have to put a special note of the other things I mentioned, that probably this patient is a vegetarian, for example, because vegetarian, meaning they're eating lots of, for example, vegetables, leafy green vegetables, and those have an impact on very many drugs, for example, blood thinning medication, so that the other people know. So I brought up this because these are now, as we sit back in our clinic, these are some of the few scenarios that we see. And I'll give this one because I saw this like among, I think 3 people this week who had this problem of what side effects of drugs can do to elderly patients. So this drug called amlodipine or nifedipine, these are drugs that manage high blood pressure. And they are commonly prescribed among the elderly patients, and they are very effective in lowering their blood pressures. But one of the common side effects that is so common, and this is why I brought this up, is they cause swelling of the feet. And this is very common. And many times, this is misinterpreted by very many people as probably a heart problem, or a kidney problem, or a liver problem. And the common action that is usually taken is to give a water pill to get rid of excess water. And now that can actually be very dangerous, and it has caused a lot of trouble in especially the elderly when we treat that swelling of the feet with a water pill. The treatment for that is not a water pill, because this person is not retaining water in them. We usually give a water pill when you're retaining excess water. The way the drug works is to actually cause that as a side effect. So usually what we do is to if it's not so severe, we usually reassure the person that maybe when you're home and you're probably watching TV, please raise your legs, the water will redistribute itself and goes back down. But many times it becomes so severe and we have to like reduce the dose or switch to a completely other drug without giving a water pill, because the water pill in the elderly is going to cause a lot more problems. It's going to reduce the blood pressure further. It's going to when we give these water pills, they usually have an effect of eliminating other electrolytes like the calcium, magnesium, potassium from the body. And that causes another problem, muscle cramps and all that. Now, another common one is some seniors I've seen when they get allergic problems like a skin allergy or a running nose, many of them have stuck to their old drugs like Piriton. Now, Piriton, as we grow older, Piriton tends to be cleared slowly from the body. And because it's cleared slowly from the body, it keeps accumulating. And once it accumulates, it affects the brain, and many seniors start to get confused. And that confusion, I just remember the classical story of one of the seniors. I think he was about 79 years, a gentleman who suddenly got confused. And we didn't know what he was taking because we thought maybe it was an infection. And when they checked, he was fine. But it was later on when I think his granddaughter noticed a small pack of tablets, and what was in was actually Piriton. And that's what was causing the confusion. So this person had actually been diagnosed as dementia. Yes, at that age, it was very easy to actually say he has it because he was in that age group. But the action here was actually to stop the Piriton, and he actually got better. So this is what these drugs can actually do. Now, there is another one that is quite common called amitriptyline that has been prescribed by very many doctors, but we want to use this drug with a lot of caution, especially in the elderly, because it has very many side effects. And two common ones are constipation, and usually the common action will be now to give something to relieve the stool, which will now cause diarrhea. Diarrhea will cause dehydration in the elderly and confusion and all that. Or sometimes it causes urine retention. And if it happens in a male, someone might think this is a prostate issue. So something like, so this is how these, and yet the action actually will be to avoid amitriptyline and use maybe an alternative drug that gives the same benefit that amitriptyline is meant to be. So these are some of the few common, for example, clinic scenarios that we see. There are quite a number of many, and because drugs are so many, it's very difficult to bring out all of them. Now, I talked of non-drug treatments, especially in the elderly, that we can use for certain conditions to reduce the number of drugs that the seniors take. For example, many seniors usually will get, for example, joint pains, and will give them painkillers like diclofenac or brufen, which will cause, for example, acidity or gastritis or heartburn. And many times we'll give the drug called omeprazole. This omeprazole, like I said, has so many other side effects. So many times instead of giving this drug, we want to do probably non-drug treatments like avoiding drugs that will trigger acidity. For example, avoid caffeine, avoid coffee, trigger foods, not eating 2 to 3 hours before bedtime. And when you go to sleep, if you have, for example, that reflux, then you have to elevate the head of the bed so that you can sleep comfortably. Then there is this other problem of frequent urination at night, which could be caused by drugs. So some people, usually when elders report that they have frequent urination at night, many times people prescribe a drug that causes urine to be retained. And that can be very dangerous or problematic in some elderly, because once it's retained, that retention can be prolonged and can cause urinary tract infections. So usually we want to find out what exactly is causing the frequent urination. Things like, again, the same culprits like the ones above: coffee, alcohol, drinking excessively in the late evening hours. Those who have, for example, heart conditions or liver conditions or kidney conditions that have swollen feet, now who are retaining fluid, Many times when you go to sleep, that fluid reorganizes itself and gets back into the system, and they tend to frequent the toilet. So usually we tell them we manage that retained fluid more during the day. So we give them the water pills during the day and not the night, so that we avoid any other new drug. Lack of sleep, we want to avoid any of these sleeping pills among the elderly because of the many effects I talked about. And I think we've had a discussion about sleep here. Again, avoiding caffeine, which is going to keep you awake. Avoid bright lights in the bedroom. Avoid taking water, which was going to cause a lot of frequenting of the toilet. And then joint pain. Sorry, this was a spelling error. Joint pains. Because the painkillers cause many other side effects, we want to use many other modalities like physical exercises. These days, many people are now practicing other exercise regimens like yoga and many others. And then reducing weight could also help, or using gels for the joints. Those can probably help. And then there's this one for recurrent urine infections, especially for the ladies. We want to many times minimize the use of antibiotics and use other things like keeping well hydrated. Cranberry juice might help prevent but not treat. Or vaginal creams for the menopausal women, because that predisposes to urinary tract infections. So these are some of the other non-drug treatment. Now, I'm coming towards the end. So the dispenser, when it comes to managing multiple drugs, we want to educate the dispenser, the person now at the pharmacy. What's their role in all this? One of them is to educate the patient about the drugs and the caretaker, if the caretaker is there, all the drugs that they are prescribing, what they do. They need to clearly label the packages, and they need to educate the patient on the probably common side effects to expect. Of course, the doctor will probably have done this, but the pharmacists can also reinforce this. And they also need to check on the expiry of all dispensed drugs, and also keeping records in case the person loses their medication. Now, the other one is the caretaker, who is very, very key in this whole scenario. The caretakers should also keep their own records, for example, of all medications taken, including any supplement, herbals, and sometimes what kind of teas that the person is taking. They need to carry a record, and then they need to carry this record at all reviews, medical reviews, because we need to look at all this and see what to change. The caretaker sometimes also needs to help us record any new symptom, because the new symptom might mean a drug interaction or an adverse effect. Any new symptom needs to be recorded, and any social habit that their patient is doing, alcohol, smoking, and all that. And what about the patient? Because most patients still have the ability to maneuver and work, or may probably go to the hospital themselves. For the patient, please have your regular reviews in person. So if you're sending for drugs frequently, we want to minimize that, because at each visit, we want to hear from you. We want to, for example, this de-prescribe that I mentioned, we want to remove some of the unnecessary drugs. Carry your medication list. Report all the new drugs that you've got along the way from other doctors, so that we share. And then you need to consult your healthcare provider before starting those other new drugs. And then I talked about proper storage of your medication, and avoid sharing drugs. This is now to the patient, because it's like I said, they are not two patients who are the same, even if they have the same condition. And I think that was my last slide. So thank you for listening. Maybe we'll take on a few questions at this point in time. Thank you.
Thank you so much, Dr. Gyaviira. I'm sure everybody has been touched. To summarize it, I would say I am guilty as charged. You charged us as women of 70, right from the bedroom to the kitchen and everywhere. Before I call upon Dr. Makanga Philippa to take us through the Q&A, I'll personally pose my question. Doctor, you've talked a lot about drugs swallowed by mouth, and us women, we have another slot where we love to care about our skin, and right from the face or the hair, we put a lot of stuff on our heads, we put a lot of stuff on our faces, and the general skin. Do you have particular cautions or drugs you think may be causing us damage without our intending to have that our bodies damaged? Because the skin does take in a lot of drugs. Over to you, Dr. Philippa Makanga.
Thank you very much for the presentation, Dr. GM and the moderator. We are now in the session of Q&A, and the chat has been very active, I think, and we do not have any hands up yet. So I'll invite you to start with a question that was posed by the moderator, and then we can move to the ones in the chat.
Thank you so much, moderator. Now, skin, yes. And like I said, this topic is quite wide and quite complex. Now, when it comes to skin products, what we are interested in is to know what active ingredient is in the skin product, because there are very many. Some people might think that the skin products do not penetrate. Very many of them penetrate and get in. I'll give an example of two. For example, skin products. Then come back to maybe the question. There are, for example, steroids. What they call steroids. I'll just leave it as a general term as steroids, hydrocortisone, betamethasone, that we use many times for itching skin and all that. A small proportion of those steroids definitely finds their way into the bloodstream. Unfortunately, when used for a long period of time, they keep thinning the skin. And as the skin keeps thinning, the easier it is for all other skin products to get in. Now, there's something that has come out on the radar of very many researchers and now clinicians like myself about very many products out there. Many of them, some of them actually are skin products, like the moderator mentioned. When they get into, because they have particular chemicals, and remember I told you environmental chemicals, when they find their way into the system, they are going to interact with very many organs. Now, there's something that they call, it's a medical term, and I'll kindly bear with me. They are called endocrine disruptors. But what that means is that there are organs in the body that produce hormones that to help us basically live a healthy life, like your thyroid, like your the kidney itself, the pancreas. When those chemicals, including very many of them that are contained in these skin products, interact with those organ systems, they make those organ systems function at a higher or overfunction. So you will pour out a lot more hormones. So we call them endocrine disruptors, and some of them fall into those skin products. So many times we need to know the ingredient in those skin products. We've also heard of these other products like the ones, again, women want to use, especially around this part of the world, to bleach. Many of them that contain mercury. That mercury finds itself into the skin and into other organs like the kidney and causes kidney failure, damages blood and causes blood problems. So it's more about looking at the ingredients, if I may answer it that way. What is in the drug, in the cream, sorry. Thank you. I don't know if I've
Thank you,
answered
Dr.
this.
Right. I'll just start at the top. We have many comments in the chat, but one of the questions is how can we keep the vital organs like the heart, kidney, and liver in tip-top shape? And next question is moderation is key for herbs. It's not a question, it's a comment. Moderation is key for herbs, fruits, and please advise on the use and contraindication of Dynapar with drugs and food when used for pain. And then how about hibiscus, rosemary, and cloves? Maybe you can comment on those and we'll take another set of questions and comments.
Okay, thank you. I think so. Someone who asked, how do we keep our organs, the main organs, the kidney, the liver, the heart, in good shape? I think the message, I'll just give general recommendations, because most of the general recommendations actually work for the well-being of the entire body, including those organs. One of them, of course, is to keep as healthy as possible, meaning as we age, be as active as possible. For example, for the heart, the heart needs to be used for it to function very well. Of course, we need to eat healthy, and these are the same messages that have always been coming around. We need to eat a healthy diet, lots of vegetables which contain all these health benefits. Drink plenty of water. The person who coined the term water is life. All these organs here, the kidney, the liver, the heart, and any other organ in the body needs water. We need to adequately hydrate all the time. And for the elderly, it's very important because we are taking in so many chemicals through drugs, like I mentioned, but also through the environment. We breathe in so many chemicals, we eat so many chemicals. So we need to wash them out with water. When we don't, those same chemicals accumulate and interact with your drugs. And then keep as active as possible. Sleep well, because I'm sure we've discussed about that before. Sleep, go out into the sun, drink plenty of water, avoid alcohol, avoid all the other, it's the same messages. Avoid smoking, avoid the fried foods in high amounts. That basically will keep your organs healthy, and always have them checked at least once in a year. At least once in a year. For the elderly, sometimes we have to make it even more frequent. And then someone said moderation is key. Yes, moderation has always been key. So we don't want to say stop, but it's about moderation. And then there is a question about, I think, Dynapar. So Dynapar, for those who don't know, Dynapar is it comes in different forms. I don't know which Dynapar they talked about, but I'm assuming that they talked about the Dynapar spray, which is a painkiller spray. Dynapar spray tends to be, I think, is safe because it doesn't penetrate. Not so much of it penetrates deep into the bloodstream, so it is actually safe. But you need to use it with caution, because if you have an open skin, then you don't want to put it anywhere near the open skin, especially if you're an elderly, because then the active ingredient in there is called diclofenac, and that diclofenac will definitely have other effects like high blood pressure and then kidney damage or liver damage. So we need to be careful with it. And then someone mentioned other I think other remedies like hibiscus, cloves, and I've forgotten the other one.
Rosemary.
And rosemary. Yes. I may not have an answer to all of them, but hibiscus, for example, hibiscus is very healthy. It's a very healthy product, and there are so many, I think, supplements that contain hibiscus there. Hibiscus has got very many properties. It has blood sugar lowering effects. Hibiscus has also got blood pressure lowering effects. So it's the same as what ginger, garlic, and turmeric do. So we also need to use it in moderation. And when you're taking it with multiple drugs, especially for pressure and blood thinners, please always inform your healthcare provider, because we might need to adjust your doses, sometimes downwards. Now, rosemary also does the same thing. Rosemary has also got blood thinning effects. Rosemary, I think, has also got blood pressure lowering effects. And rosemary, to some extent, has got what we call a diuretic effect. It has like a water pill effect. It makes some people like pass out a lot of urine. So we want to be very careful for anyone taking rosemary, and I think cloves also does the same thing with drugs like blood thinners. You need to inform your again, your healthcare provider that I'm taking rosemary, so that maybe during that time when you're taking your blood thinning drugs, it's the rosemary is off. So it has those effects, and we need to take them with caution. Thank you.
All right. So another set is a teaspoon of grated ginger added to half liter of water, too much or moderate, sorry. And then a comment, more commonly, medical facilities concentrate on money and care less about treatment. Might you have some advice for us? This is a request to share the simple card chart for the drugs. And
Okay.
I think maybe you can start with those while I find the other questions. There are many comments in between. You can take those while I find the other questions.
Okay, thank you so much. Sorry, I don't know who asked the questions, but I'll try and answer them. So a teaspoon of ginger, I think that should be moderate. That probably falls in the category of moderate, which should be safe for whoever asked it. So that should be safe. And then I think that second one is a little bit too complicated for me. The medical facilities, I think, minding more of money than treatment. Well, I may not have much to say about that because it also depends on probably where you go. But I think the oath we took to look after and save life, ideally, we are supposed to put patients' lives first. That should be the ideal situation. And I think when we're managing this patient, any patient, not just the elderly, but any patient, we are supposed to be as clear to the patient as possible. And build a level of trust. In case, for example, I'm unable to manage you, I should be able to refer you. That should be the thing. I should not do guesswork and experiment because patients are not guinea pigs. The guinea pig work was done by the researchers long ago. So I should not be able to not experiment a drug on a patient. So for the prescribers or the doctors on this forum, I think let's remember that if you cannot manage any condition, please refer. And there is no shame in referring because no doctor knows it all. Personally, I don't know all the drug interactions I don't even know a tenth of them because there are so many drugs on this planet. So there's always be someone in their specialty who will take care. And then someone, I think, said we'll share the simple card. Maybe we'll just share the presentation and then you'll pick out the card. I just actually got it online, but there are many. You can actually do one that is that's tailored to your facility. And then you add in a few other things. Thank you.
Okay. We have another question from Alice. She's asking if it's okay to chew a capsule. And then Emma is asking about the GLPs and GLPs for weight loss interacting with other meds, if you can comment on that. And then how do we minimize memory loss among seniors that take multiple medications and are quite stressed within their family settings? And then can you speak about drinking bicarbonate of soda? And how about collagen supplements? I'll stop there for now and let you answer those.
Wow. Okay. So let me start with the first one. That was about GLP agonists.
It was about
No, sorry,
chewing a capsule.
chewing a capsule. Now, there's a reason why they put some of those drugs in a capsule. The capsule is a kind of hard gel, and it's basically to help it navigate through probably the harsh environment of the stomach, because the stomach has got a lot of acidity. So one of the reasons is that when the drug drops into the stomach, because it has to pass via the stomach to get into the intestines, and the intestines is the site where most of the absorption of food, nutrients, including drugs, happens. So some of those drugs put in a capsule, one of the reasons is to bypass that damage by the acid in the stomach. That's one. The other one is, the other reason could be that the ingredient in the capsule might probably be easily denatured again by the acid, or it might be very unpalatable when you break the capsule and take it live. Take the drug. So it's best to take the drug as has been formulated. If it's a capsule, take it as a capsule and saw it as a capsule. But I might have maybe help from a pharmacist who is here. But those are some of the reasons I think why it's taken in that form. Now, the other one was about the
GLPs, which are taken for weight loss, and how they interact with other meds.
Now, GLP drugs, for those probably people who may not know about GLP drugs, these are drugs that have been developed in the recent past, and they were developed specifically for managing diabetes. And most of them have come in form of injections, though now there are some that are tablets. I may not have the entire information about their interaction with so many with other medications, but definitely they did. All drugs, probably the take-home message here is that all drugs definitely interact with some drug, one or the other. I am yet to check the interaction of those medications with other drugs. Probably one of them would be if you're combining them with other drugs for diabetes, because then your sugar levels might drop so low. So when you're taking those drugs, I think it's incumbent upon your doctor to probably adjust the medication of the other blood sugar lowering drugs, including your other herbals that we've discussed that lower your sugar. I think that's what I would probably say. And maybe also the other interaction that will be significant will be with your people who take drugs that, like insulin, for example, then they have to be very careful when they mix the two. But right now, I think many people are now using them a lot more for weight loss and not diabetes. So if you're using them for weight loss, I think one of the, I know probably this is, I'm going to digress a little bit. They definitely will reduce your weight, but we are concerned about the overall impact they have on your body, because you're going to definitely lose the weight, but you're losing both muscle and fat. And as we grow older, we want to retain the muscle. So as you're taking those drugs, we want you to at least take, again, in moderation, a protein-rich diet, and also to be as active as possible to maintain your muscle. So it's very important, especially when you're doing that, when you're taking those drugs. Now, the other question I think was about minimizing memory loss, especially with the use of many drugs. Now, minimizing memory loss, this needs, again, it's because the causes of memory loss are so many, and I think we've had a discussion here before about memory loss. There are so many. There is the age-related kind of memory loss, which is called Alzheimer's. There are many, there are disease conditions that will cause memory loss. There are conditions like high blood pressure that will cause vascular dementia. So minimizing memory loss probably starts with preventing it in the first place, especially for the preventable causes. One of them is, again, living healthy habits, preventing alcohol or probably not drinking at all, smoking, managing your blood pressure, especially in your younger years, adequately well, eating extremely well, because once it sets in, there are no drugs that are going to cure it. Most of the drugs that have been designed are probably helping to slower it, but not cure. So it's best prevented, probably, the ones that have been able to prevent it than minimizing it. And then the drugs that they give, it's supposed to be a teamwork again, because we usually, when managing dementia or memory loss, we need to factor in all the other organ systems that are probably affected, will be contributing to it. That multiple drugs, and then we also involve our colleagues, the geriatricians, the psychiatrists, and the counselors, and that's how we'll probably be able to manage it. And then the other question was about the collagen supplements.
Yes.
Now, I don't have so much information about collagen supplements, but some of them on the market, I know there are some that are in form of tablets, and I think the evidence that is out there is not so strong that they actually have a serious benefit, because collagen is a protein in science. When you swallow that collagen, that protein, it's going to be digested in the gut. So there's a gray area of its benefit. Some people actually are on the side that it's more of a psychological or placebo effect. But I'm yet to go back and look into the other evidence that is coming out. Maybe someone else who has much more information will probably enlighten us on that. There was another question that I can't remember.
I believe you've handled those. Oh, sorry, it was about drinking bicarbonate of soda.
Oh, bicarbonate of soda. Thank you very much. Bicarbonate of soda is depending on how the person wants to use it. We need to use it with care. Bicarbonate of soda has got a very huge content of, in quotes, salt or sodium, because it's called sodium bicarbonate. Now, sodium bicarbonate, some people I know are using it a lot to manage their acidity. Yes, it's going to neutralize the acid, but you need to be very careful when using it, especially with the seniors. Now, when you're consuming a lot of sodium bicarbonate or bicarbonate of soda, you're increasing your sodium intake, and that sodium has got so many effects. It's going to retain water and it's going to shoot your blood pressure up. That's number one. Number two, if you have other underlying conditions like heart problems or kidney problems, it's going to affect the effect of the other drugs, especially the water pills, and also even your heart pressure medication. So those people who have heart problems or high blood pressure or kidney problems, we are very careful when giving them or prescribing, because some of this bicarbonate of soda is actually in form of tablets. We are very careful when prescribing it. Many times we prescribe it for kidney patients because it also helps us to neutralize the other acids that accumulate because of kidney failure. But even then, we have to use it with caution, because it's going to make someone get overloaded with fluid, because the salt in there attracts a lot of water, and that will cause disaster. So we use it with caution. So those who are using it, please don't overuse it. Use it with a lot of care.
Okay, some wants to know whether walking, some says he sits a lot while driving, sitting in the office and working, and wants to know whether walking 25 kilometers outdoors done on 3 days is active enough. Then apart from drinking water, how best do we detox our bodies? We receive too much information from different experts. Thank you for the presentation. This is a comment. There's a comment from Thomas, but it's not clear what his question on the current government policy is. Thomas, if you could kindly raise your hand and we'll invite you to ask your questions. And these are comments about the presentation. Okay, maybe you could take those two questions for now.
The one about walking a lot. That's a very
Yes.
good one. I think whatever, I can't remember the name of the person, but whatever he's doing, walking a lot is very good for him. And congratulations to him, because not many people can walk those many times in a week. It's definitely healthy, given the fact that he has mentioned that maybe he sits a lot in office, in the traffic jams. Ideally, the thing to do will be to actually be as active as possible the rest of the week when you have the time. So it's very healthy, and he needs to continue, because the recommendation is about 150 minutes per week. So I'm sure if he's doing that, probably he's somewhere around the 150, which is very healthy for him. So he can continue doing that. The other question was about, I think, detoxing. Now, this is my personal take on this problem about detoxing. I think there's a lot of miscommunication and about detoxing, because everyone wants to come out and give their own remedy about detoxing. Now, without even anything external that people are advertising out there, God was so gracious to us that he actually gave us a system within our body that detoxifies itself. So when we sweat, for example, that's a form of detoxifying. When we pass urine, you're detoxifying. The liver, as long as it is functioning perfectly well, one of the functions that I remember, if you remember your basic science in primary, they will say what are the functions of the liver, and one of them was to detoxify. The liver detoxify, it denatures any chemical that comes into the body to make it, and I mentioned that earlier in the beginning of the talk. The liver, one of its role is to transform anything foreign into something that can be excreted. That's one of its role, together with the kidney. So to help them do that functioning better is to supply them with water. So these are natural things that God gave us. So anything else that comes in, that the concoctions that people say these are natural detoxifiers, we need to take them with a bit of caution, because many of them, like I've mentioned here, have got a lot of chemicals. That's one. The others actually have a lot of these ingredients, the calciums, the magnesiums, and you might go overboard. I remember in around COVID time, probably, let me just slot in this. People were taking a lot of vitamin C. If you remember, I'm sure many of us did that. And out of the blue, pharmacies were now giving us very high doses of vitamin C, which is not a bad thing. Vitamin C is a very good, healthy vitamin, which we need in our bodies, because the body doesn't make it, so we need it. Now, what would happen? People would take fruits and vegetables in moderation that we need, that have adequate amounts of vitamin C. And then they will take these tablets that were highly dosed in vitamin C. So we're overloading ourselves in vitamin C. Now, in my area as a kidney doctor, I remember getting a couple of patients who came in with pain, excruciating pain. I remember 3 classical cases, excruciating pain. And this pain was actually because of kidney stones. And where the kidney stones come from? From vitamin C overdose. So now this is on the extreme. And I know some of the detoxifying effects actually have a lot of the vitamin C and other fruits. So as we're using all these ingredients, they will be good as a supplement to supplement some of the things you're lacking, but we need to take them with care. So my take on detoxifying will be, maybe you need to routinely check on your liver, your kidney, and maybe your heart regularly, especially with the doctor, and do the routine follow-ups, and drink plenty of water. That's my take, and that's what I tell a number of my patients about detoxifying, because that's the natural way that I know. Thank you.
All right, we're coming to the end. Thomas, if you're still there, you're welcome to unmute and ask your question. It wasn't clear what you wrote in the chat. Just a few more questions while we wait for Thomas. Thomas, I see you're unmuted. You can go ahead.
Yes, thank you so much, the presenter, Doctor, for a wonderful presentation. Well, I come from a point of view of the recent policy the government sets in of integration of our medical services, as though they wish to now see a HIV clinic, they no longer want to see a diabetic clinic, they no longer want to see NCD clinic at these lower health facilities, and which have been practically centers where simple specialized care has been for these. What I mean is, as a clinician who has been much in HIV care, I made much more knowledge and I made much more practice in that area of HIV clinic that my counterpart, who's equally a general practitioner, may not have. Now, my question is, Doctor, what have you to take where these seniors need ideally specialized attention? Not specialized in a way that people have overgone for training, but someone having focused time for them in a special way at these lower health facilities. Don't you think that our general practitioners, who ideally are touching every kind of patient at the same time, at the same day, are likely to make many more errors that we have understood today from your presentation? And what advice do you give to the government over this? I thank you.
Thank you so much, Thomas. And I think your concern is very genuine and at the same time of concern. One of the neglected groups in the healthcare is the elderly. Extremely neglected because there are so many aspects related to the elderly that many young doctors will actually attribute very many of their problems to aging, which is not entirely true. Because like we've seen, most of their conditions are actually created by us, the doctors. We give them multiple medications and cause side effects and even cause death many times, unfortunately. So I share your concern and your views. I'm not a policymaker. I think there was a policymaker here. I saw Dr. Obuku putting a hand up. One of the probably what I think is in the national referral hospitals, which are probably in all corners of the country, one of them will probably be to open up an elderly clinic and maybe to train those healthcare cadres who attend, for example, medical officer or medical officers, probably how to handle the elderly and when to refer appropriately and to who. That's what I would think, because like you rightly said, the specialists in the country are very few, and majority are confined to Kampala. So someone in Adjumani probably is going to be the only specialist they can see probably is a nursing aide. And you can't blame the nursing aide because for her, she will just be prescribing according to symptoms and not according to the disease condition. But if the person can access probably the nearest regional referral hospital or health center with a trained probably medical officer or to some extent even a clinical officer on when to identify particular conditions, especially in the elderly, it will probably make a difference. I don't know, probably that's my take.
All
Thank
right.
you.
We have several comments in. The last one was a comment about peso. Someone is taking peso for weight loss and had a concern about whether that is okay.
Tezo?
Peso.
Peso.
P-E-Z-O.
I'm not so sure about, I'm not well versed with
Maybe,
peso.
Carol, you can unmute and let us know what peso is. In the meantime, there was another question I think I skipped about the use of keto to manage weight gain and chronic illnesses like diabetes.
The keto diet.
Yes, keto.
Now, the keto diet is also another condition that has been, I think, misunderstood by many people. What keto diet means is consuming a diet that is non-carbohydrate, no sugar, but it's predominantly fat and protein, so that you get your fuel source from those two, from fat especially. And yes, it does well, especially with weight loss, and it will do well with as an alternate fuel source. It has its challenges, especially with sustainability, because when you have to be in a state that we call, the medical term is ketosis, where you're generating those, what they call ketones, instead of glucose. So ketones are the other alternative sources, aside from glucose. And yes, you will definitely lose weight because you're going to burn your fat. The challenge comes in with sustainability, because many people will eventually, along the way, maybe take a biscuit or a cake. And once you do that, you've basically broken your cycle of generating that alternative fuel cycle, and you'll now get back into where you came from. Your insulin levels will go up. And once insulin goes up, then insulin tends to lower sugar, but at the same time, on the other flip side of the coin, insulin is a fattening hormone. It will make you put on more weight. But when we're using keto diet also, we also need to factor in the underlying condition. Again, because this talk was more to the elders, we need to be very careful with the underlying condition that the senior might have. For example, if the senior has some kind of kidney compromise, the keto diet predominantly will not be the place to go, because it's going to generate these ketones, which are acids, and they're going to build up in the system and cause more trouble. So we need to tailor it to the particular person. And before we get into a keto diet, usually we want to bring in our dietitians or nutritionists to also guide the person better than you starting it full blown, because you might end up getting other problems. But it's otherwise a diet that can actually work for many people.
All right, we are way past our time. Just I will allow Ronnie to speak, but before Ronnie speaks, just a comment. Damali put a comment in line with detoxification. What could be your advice about the pill burden and effect of chronic treatments alongside the side effects and ailing organs?
Okay, the side effects about pill burden and
your advice about the pill burden and effect of chronic treatments alongside side effects and ailing organs.
Okay, just to repeat, because probably this is what we've discussed, that the more that the drugs that the person is taking, the more interaction, the more side effects that the person is going to get. So as doctors or prescribers, we need to review all those, that entire list of drugs and see which ones are of benefit and the ones that are not necessary, and which ones are potential drug interactors that will cause trouble, because we need to de-prescribe, to remove what the person does not really need. Like I said, one of the myths was some people are very hell-bent on taking multiple drugs because they feel they need so many drugs, including supplements. Yet in actual sense, many of them will actually do nothing, and what they are doing is basically to interact with others to cause other adverse effects or have no effect at all. So as we are but where all the pills are necessary, especially in conditions like kidney problems, heart conditions, or diabetes and its complications, then we encourage, again, we have to look through all of them and see how to space out some of them. The ones that have potential interactions, we space them out. Maybe take some in the morning, others in the evening, or others at lunchtime. And the other part of it is to drink and hydrate as much as possible to help the liver and the kidney to transform and excrete them out as fast as possible so that they don't accumulate. Thank you.
All right. Ronnie, are you still with us? You can unmute and ask your question. This will be the last question before I hand back to the moderator.
Yeah, my comment is written there, which you haven't read, but it was concerning skin. Dr. Christina had asked about it. I made a suggestion, and one of the oils, sesame oil, is good also for painful joints. it's a bit long. If you can read it for us, for some people. That's my comment. Thank you.
Ronnie, since you're speaking, you can go ahead and say what your comment was about.
Okay, let me. Whoa. Yeah. I was suggesting that with regard to skin applications for the elder persons, cold pressed oils are very good, especially when they are kept in cool place because they go rancid. And somebody might feel that it's a bad smell, but I had suggested coconut oil, sesame oil. We have a lot of it from the Nene. Those are the cheapest options. There's shea butter, baobab, or moringa. Those are mostly costly, but they soften the skin and they preserve moisture, which is essential in old age. That was my comment.
All right, thank you, Ronnie.
Sorry, maybe just to add on, I think it's a very good comment about that skin. The sesame oil products, what I know about them is that they contain very good amounts of vitamin E, which is a very good product for skin, for the skin. And it's also a moisturizer. So it's a healthy product. But back to the person who I think her concern about peso, I was just trying to check it out. I think it's probably meant for acidity mainly, but I think whoever prescribed it for you, you need to go back to them. If you're taking it alone, maybe it might be harmless, but if you're taking it with other drugs, then you need to be very careful with which drugs you're taking it with, because it might interact with other drugs in terms of absorption, because if you're using it as a slimming pill, it might impair the absorption of the other drugs. And that's where the problem might be.
All right.
Thank you.
Thank you very much, Dr. GM, for your presentation and patiently answering our questions. We have gone over by about 10 minutes. So I'll hand back to our moderator to close the session. Thank you very much. Dr. Obuka, I see you clapping. Did you have a comment? You had a comment at one time. Back to you, moderator.
Well, thank you so much, Dr. Gyaviira Makanga, for running that Q&A. And I want to ask everybody to give an emoji of thankfulness to our presenter this morning. Thank you so much, Dr. Makanga, Gyaviira, for this incredible, insightful, and practical presentation. You have given us all, both older adults and caregivers, the vital tools and knowledge we need to manage multiple medications safely and confidently. We are deeply grateful for your time and expertise today. I want to thank all the wonderful audience for your active participation throughout, for the questions and comments and experience this morning. Actually, we had Anne Bachaita, who deals in supplements, and she's very willing to take us on in a session on supplements. Thank you so much for logging on every last Saturday of the month. And for those who have been with us for the whole 4 years we've been here, thank you so much. And we want to thank the many who have joined us today. Thank you for putting your emails and other contacts in our chat box. We shall definitely share the recording with you. As we conclude, let us keep an updated list of all our current medications, including the things we love to eat and drink, those herbs we mix for breakfast and for all sorts of times for sleep, and we normally don't take them seriously. Please include them on the list. It's a hot season. Please remember to take a lot of water and always consult your doctor or pharmacist before adding on these various drugs or supplements to the list of what you take every day. Visitors are very good at prescribing. If with someone comes to see you, they always want to give you something to relieve your problems. Yeah, and when you visit the doctors, please ask questions like you've done today. And for the caregivers, help to write down those questions the older adult may have, and make sure you use the consultation time profitably. Yeah, thank you so much, our participants. And our next Purposeful Aging session will be on the 25th of July, 2026. We look forward to seeing you all online once again. Until then, please stay safe, look after one another, and have a wonderful weekend ahead. Thank you and goodbye from Purposeful Aging team. Thank you.
Thank you too, and have a nice